this course, it's a dog training course, so it will teach you how to get to where you need to be, but also it's a human training course so that you can read your dog better and read scenarios and pick a job assignment that is appropriate for you and your dog, and then hook you up with the resources too, so that, once you're done, you can kind of hit the ground running. The dogs basically just brush up on what they need to know. So they need to, for example, be able to greet people without jumping up on them. And they need to be able to walk nicely on a leash and stay under the handler's control in distracting environments. It requires a certain type of temperament. You have that as a foundation, and then the training comes in to teach them the appropriate manners and a really solid leave-it for someone's oatmeal cookie sitting on the table, and you know what I mean? So there's this temperament component where the dogs have to really enjoy the job, but there's also a training component of, don't touch the oatmeal cookie sitting on the table, don't stick your face in that child's face unless they want you to, like that sort of thing. So it's really, it's some self-control work and making sure they're really comfortable around different weird things.
It's very fulfilling to go through Joanna's therapy dog class and then to test what you've learned with your dog in a real situation. I just feel like our relationship is stronger in knowing what she's capable of.
We go over how dogs think and learn so that they can harness that power to make sure that they're teaching their dog appropriately at all times. And they learn a lot about reading dog body language and emotions.
Otto's disposition is such that he just enjoys being around people and being touched.
So our therapy dog teams are all over our hospitals. We use them a lot on our patient floors where they go and have direct visits with our patients. We use them in our ICUs, and again just brings a nice little bit of normalcy to those patients in the ICU. So for some patients, what we see is a decrease in their anxiety. Nobody wants to be in a hospital, and the pet therapy visits really help kind of bring some normalcy to their day. Additionally, we see a lot of loneliness being eased by these pets. Again, these patients oftentimes have their own pets at home that they haven't seen for days or weeks, and really brings a companionship to their room.
Watch the tail.
Our pet therapy teams are here 1 hour a week. All of our dogs have to have a Canine Good Citizenship certification. In addition, they need to belong to a registry of therapy animals, much like the Alliance of Therapy Dogs.
I'm a vet. I did 20 years, and it's just kind of our way of trying to give back, to the VA. We'd like to go down there and volunteer. If we can make people feel good for 5 minutes and just take them away from the situation that they're in, that gives me reward, and I think Otter feels the same.
You could have 40 pet therapy teams and still not have enough for the needs of our organization.